Hi, I'm Stacy. I'm going to be your nurse today. I need to do a head to toe assessment on you. I'm just going to sanitize my hands real quick. Can you tell me your name and date of birth?
Madeline Grace Roth and 2996.
Okay, let me just check to your RBN, Madeline Grace Roth. Date of birth matches, and I'm checking her medical record number to her chart as well. Do you have any allergies?
No.
Any allergies to meds?
No.
Food?
No.
Latex?
No.
Any tape?
No.
Or environmental allergies?
No.
Okay. What name do you prefer to be called?
Maddie.
Maddie. Maddie, can you tell me where you are?
Lakeland Regional Hospital.
Do you know what day it is?
Friday.
And do you know who our president is?
Donald Trump.
Okay. Maddie is alert and oriented to person, place, and time. Okay, Maddie, are you in any pain right now?
No.
No pain, good. Okay, so looking at her body, she doesn't seem to be in any signs of distress. Both sides of her body look symmetrical, just looking at her lower extremities here as well. Arms look symmetrical. She's alert, oriented to person, place, and time. I'm looking at her IV now, and there's no tenderness. Does your IV site hurt at all?
No.
Okay, no tenderness, no redness, no swelling. IV does not seem to be infiltrated, and at this time I would also follow up the IV line to make sure that there's no kinks in the tubing. Okay, at this time I'm just going to look at your hair, your skin, and your nails. Do you mind if I take your ponytail out? So assessing her hair and her scalp seems to be, hair is clean, scalp is clean, no lesions, no rashes, no sores or anything on her scalp or her skin. Don't see any rashes or lesions on her skin. Checking skin turn at this time. Skin is tinted and elastic. And check capillary refill. Less than 3 seconds on her hand. I'm going to take your sock off and assess it on your toes as well. Less than 3 seconds. Do you mind if I just leave your socks off? Okay. All right. So capillary refill on both hands and feet are less than 3 seconds. Okay. Maddie, at this time I'm going to assess your head, your ears, your eyes, your nose, and your throat. Looking at your ears, there's no rashes, ears are intact, no lesions. Look at the other side, intact, no lesions. And look at your eyes. Okay, I have a light, I'm just going to shine it in. So just look straight ahead for me. Looking at your pupils, making sure they're reactive. Okay, can you follow? Very good. So her eyes or pupils are round, equal, reactive to light and accommodation, and the conjunctiva is clear, and sclera of her eyes are white. I'm going to look up your nose, your nares. Nares seem to be pink. No signs of discharge. Can you open your mouth for me? Can you stick out your tongue? And mouth is moist and pink. Can you smile for me? And face is symmetrical. Okay, Maddie, I'm going to assess your respiratory. Just looking at the patient, she doesn't seem to be in any distress breathing and no use of accessory muscles to breathe. Are you having any trouble breathing?
No.
Any chest pains?
No.
Okay, now I'm going to listen to your breathing. Can you sit up for me? Betty, can you come this way a little bit? Each time that you feel my stethoscope touch your back, can you take a breath for me?
Mm-hmm.
So move your sports bra. Okay, very good. You can sit back. And then also, if the patient was using an assist spirometer, I would show them the proper way to use it, and then also ask them to demonstrate that for me as well. Okay. Okay. Maddie, at this time, I'm going to listen to your heart and do a cardiac assessment on you, okay? I'm going to go ahead and palpate your carotid on each side, and your radial pulses. And then also your fetal pulses. So we'll go ahead and sit a little bit. Okay. Pulses are strong, no thrills are felt. And then I would also palpate her PMI, which is at the 5th intercostal space, mid-clavicular line, and listen for any lifts or heaves, which none are notated. Now I'm going to listen to your carotid and your heart as well. So the carotid will be on each side of your neck. I'm going to listen to your aortic, which is the 2nd intercostal space, right sternal border, the pulmonic, which is the left intercostal space, left sternal border, your Erb's point, which is the 3rd intercostal space, left sternal border, your tricuspid is your 4th intercostal space, left sternal border, and then your mitral valve, which is your 5th intercostal space, mid-clavicular line. Okay? I'm going to listen with my belt and my diaphragm. Just going to let it down just a little bit. And then the 5th intercostal space would be here under your breath. Okay. Listen with my bell. And then the mitral as well. So the heart is a regular rate and rhythm throughout with no extra heart sounds noted. Right, Maddie, now I'm going to assess your GI, listen to your abdomen, and look at your abdomen. I'm just going to pull your gown up and you have shorts underneath. Okay. So looking at her abdomen is normal, symmetrical, don't see any pulsations present. When was the last time you had a bowel movement?
This morning.
Any nausea, vomiting, diarrhea?
No.
No, and no pain in your abdomen?
No.
Okay, I'm going to listen. And then vowel sounds are present in all 4 quadrants. If I didn't hear a vowel sound, then I would listen in each quadrant for 5 minutes. I'm also going to listen to her aorta. And no bruits noted. Okay, and then I'm going to just lightly touch on your belly. Any tenderness? How about here?
No.
Here?
No.
Here?
No.
Okay, I'm going to palpate a little bit harder. Here?
No.
How about here?
No.
Here? Okay, a little lower. Okay, so no masses, no guarding, and no tenderness present in her abdominal area. Okay. Maddie, let me just pull your gown down. How frequently do you use the bathroom to urinate?
About 5 to 6 times a
Okay.
day.
Are you any excessive urination?
No.
Any pain or burning when you urinate?
No.
Okay, and then I would also monitor intake and output for the patient as well. Okay, and how about any swelling or numbness, tingling in your extremities?
No.
Nothing there? Okay, can you grip my hands? Okay, I'm going to test your strength of your feet. Can you push against my hands? Okay, can you pull against my hands? Very good. Okay, all extremities seem to be strong. So at this time, we're done with our assessment. And do you have any questions for me?
No.
Okay, this is your call light. I want to make sure that I leave this with you. And the big red button's what you're going to push. Can you point to what you would push if you need to call me? Okay, make sure that her bed is in low position, which it is, and the side rails are up. Is there anything else I can do for you?
No.
Okay. Alright. So Maddie, if you need anything else, just please call me, okay? Just push your call light. All right? Okay, thank you.